Hi, my name is Mary Dalton, and I did my research project on autism. Autism is also known as Autism Spectrum Disorder, or ASD. Autism is a complex neurodevelopmental disorder that affects behavior, communication, and social functioning. 1 in 68 children are diagnosed with autism in the United States. There are different levels of functioning in autism. There's the high functioning, which is like Asperger's syndrome. They require minimal help. They less help than low functioning autism. The low functioning is the more severe form that require a lot of help. Boys are more likely to be diagnosed than girls are, and non-Hispanic white children are more likely to be diagnosed with autism. The symptoms of autism are different from each case. For each case, language delays are one that are common among most cases. 75% of diagnosed children show some type of language delay. They also have a failure to engage in typical babbling and pointing in infancy. They have a failure to make eye contact beginning in infancy, a failure to respond to their own name, loss of previously acquired language and social skills. So what they had previously learned, they no longer use or have. They also have unusual responses to sensory input. This means that, for example, light can be bothersome to their eyes, sounds can hurt their ears, and just a simple touch can cause them pain. They have unusual movements such as rocking, head banging, and flapping of the arms. They have difficulty playing or interacting with peers. They prefer to play alone. They have a difficulty understanding tone of voice, body language, and gestures. They also have obsessive interest in a topic. For example, a 5-year-old boy who is autistic may have an interest in dinosaurs. Though this is not uncommon, because most 5-year-old boys at some point have an interest in dinosaurs, an autistic little boy will become obsessed with it. It's all that he wants to learn about, read about, play with. He may even only wear dinosaur clothing, eat on dinosaur plates, and drink out of dinosaur cups. Everything they do is about dinosaurs. They also have a difficulty breaking from routine. They prefer things to stay the same and not change. When things do change and they get off their routine, that will cause a meltdown. So what causes autism? Some believe autism is a genetic component. Others believe that it is due to exposure to environmental factors, infectious agents, vaccines, prenatal medications, or food additives. The vaccinations that they believe cause autism is the MMR vaccine, and in that vaccine is a drug called thimerosal, and they believe that this is what is causing autism. There's no definitive proof of this, it's just what some have come to believe, and this is because they come at the MMR vaccine happens around 18 months, and that's usually when the signs of autism start to show. Diagnosis is usually around age 3, so symptoms can start appearing before then. To get a diagnosis, it takes some time, but there's not an actual test that can be given to say that one has autism. Early diagnosis leads to a better outcome, so the sooner that they get a diagnosis and the treatment gets started, the better their outcome will be. The doctor can get a history and symptoms of the individual through several different aspects. This would be like through patient interviews, observed observing behavior, testing cognitive and language abilities. They will do tests to rule out other disorders, and they may interview the parents and or teachers. There are several different types of treatment that can be applied, such as therapy. The first type of therapy is applied behavioral analysis, or ABA therapy. This therapy, the goal is to increase positive behavior and social interactions and decrease negative. So when they are in the middle of a meltdown, instead of giving into their demands and their wants, you could tell them that once they calm down and you ask in an appropriate way, then they can have the item that they're wanting. Occupational therapy is another form of therapy that is used for autism. This teaches them skills needed for daily life, and social skills can be thrown into occupational as well, and social skills will help them learn how to interact socially, such as making eye contact. Play and music therapy is another one that is used, and it helps autistic individuals explore and show their emotions. One treatment that I just learned about is the autism robot. This idea emerged in 2009, and the idea behind it is that the robots can help autistic individuals learn how to interact socially by learning how to read facial expressions and basic socially acceptable behavior. This idea is amazing, I believe. It would enable therapists to deliver treatments more effectively and can prompt classroom teachers, aides, and parents with limited training through the steps needed to teach an autistic child a skill. There's no medicine that is used to treat autism. Usually the medication is used to treat a co-condition such as anxiety, hyperactivity, and aggression. The stimulant drugs are used for inattentiveness, isolated, unresponsive children, and the tranquilizing drugs are used for obsessive compulsive disorders, and antidepressants are used to stabilize moods. The family unit is affected by autism. Just because one individual is diagnosed doesn't mean that the rest of the family won't have to deal with that diagnosis as well. They will have to learn how to cope in their new normal, and each member of the family needs to be involved in the treatments and just daily living with an autistic individual. The marital relationship is highly affected. They have an increased amount of stress. They have a higher rate of divorce and a lower rate of marital satisfaction. One cause of this would be financial stress, autism, and all the therapies that is needed can become very expensive. Autism in education is an area that needs to be explored as well. An autistic individual can have an IEP, and there's several different services that can be utilized. By educating the educators, the autistic individual is going to benefit more. They need to know how to work with not just autistic individuals, but individuals with any type of disability. By encouraging any child, especially an autistic child, that it will go a long way. And I hope you enjoyed this presentation. Thank you.